Hello and welcome to TV9 News. I'm your host Ashish Parekh. COVID-19 situation in India is getting worse by the day. We are already facing the second wave. There are cases much more than what our health infrastructure can take, and meanwhile the only available way out of this is vaccination. And the problem is that majority of our population is still not vaccinated, and one of the biggest issues with this is that the age group that has been allowed to vaccinate, of course, is on priority as far as their health conditions are concerned, but that age bracket does not have the maximum population. The maximum population is a much younger group because India is a young country, and this has been a demand from across sectors to make sure that the young population of India is vaccinated, because vaccination only starts showing its effect once a huge chunk of the population is vaccinated. Now, Prime Minister Narendra Modi in this regard chaired a crucial meeting wherein he discussed about the pricing, procurement, eligibility and administration of vaccines, to make it more flexible in the phase 3rd of the world's largest vaccination drive, which will start in May 1. And this is something that will be starting on May 1st, like I told you. And here are some of the quick facts that you need to know about the vaccination from May 1st. Number 1, everyone above the age of 18 will be eligible to get vaccines for COVID-19. Second point, vaccine manufacturers have been incentivized to further scale up their production as well as attract new national and international players. In fact, in the latest news, Johnson & Johnson has also now applied to India's drug regulator seeking permission to conduct phase 3 clinical trials of its single-dose COVID vaccine in India. Third point, vaccine manufacturers would have to supply 50% of their monthly doses to the central government, and all of this would be free, and they would be free to supply the remaining 50% to the state governments and in the open market. Now, the issue here is that the price of the other 50% will have to be declared in advance, because based on this price, state governments, private hospitals, industrial establishments, etc., everyone who's procuring vaccines, they would be able to procure vaccine doses from the manufacturer knowing the price beforehand. Now, private hospitals will have to procure their supplies of COVID-19 vaccine only from the other 50% which has been reserved for state governments and for them. Now, this has been earmarked for entities other than those which are coming through the central government channel. Now, coming back to the central government, center from its share will allocate vaccines to states, union territories based on the various criteria. For example, number 1, extent of infection, which is the number of active cases, and also the performance, that is the speed of administration of vaccines. Other factor that will be kept in mind is the wastage of vaccine, which will be considered, and this will affect the criteria negatively. Now, this is of course mainly brought into picture to make sure that the politics which is happening as far as vaccination is concerned, that stops. To speak more about this, to speak more about how exactly it will happen and how the government plans to take this forward and if it is actually feasible, I spoke to Dr. Vishal Rao, who is the Director of Head and Neck Surgical Oncology and Robotic Surgery at the HCG Cancer Hospital, Bengaluru. And first of all, Doctor, my question to you of course is, now this move will cover a majority of our population that is active, healthy, and all of this could be potential asymptomatic spreaders. So how will this affect the pandemic in the country? Because majority of the population, if this phase goes properly, majority of the population will be vaccinated. So how will this affect the pandemic in the long run?
Today, the government of India's move of expanding vaccination to all above 18 is a very significant step and a welcome step. But at the same time, what the people need to know is that the vaccination that has currently been authorized under the emergency usage are all vaccination that are known to reduce disease but not infection. Now, this is a very important thing that the viewers need to understand, that most clinical trials that have been performed have shown that these particular vaccines are known to reduce disease, the scale of the disease or deaths, and not rate of infectivity or transmission, which means that even after you get vaccinated, you will continue to spread the virus. Now, in the first step, the government of India's thought was to save the life of the elderly people who are eligible.
Well, my second question to you, of course, is what do you think of this step? Do we have the infrastructure to meet such a demand, as most of our population falls under this age bracket? We've already seen a bit of problems, for example, technical issues, glitches, as far as the vaccination drive is concerned. Do you think we are ready for this vaccination drive?
While we have the infrastructure for ramping up such an activity to encompass this population, it is very prudent to understand that it is not just the infrastructure, it's also the logic. Most vulnerable population are the comorbid and the aged population, which are above 45 with comorbidities, and it is this group that is the most priority, because this is the group that is going to have the maximum number of deaths because of COVID. The 18 to 45 group is the safe group. They are the group that is going to be not vulnerable to death, and hence it needs to be understood that the priority here is to first save lives, because the vaccines are known to reduce the intensity, reduce the disease intensity or death, and not infectivity. So you will need to continue to wear a mask even after you get vaccinated, because you may still continue to spread the virus, and hence the priority has to be elderly and comorbid people.
Number 3, what about logistics and pricing? Is our current distribution chain link sufficient for handling such a massive ramp up in the vaccination drive?
Now, when it comes to logistic and pricing, I think already the government of India's first step to look at a centralized approach to planning both the regulatory and the distributor aspect of it in the usage of the first 2 vaccines that came out itself shows that the government has a very thought process. I think there's a strategic way in which the government of India has approached this whole steps. And in that way, if we use it as such a systematic approach, we will be able to balance the logistics and pricing, integrating both the private and the public sector together. And this kind of a synergistic, democratized approach will be able to help create a maximum outreach both for urban, semi-urban and rural effectively together, by joining hands between government, hospitals, medical colleges and PHCs together.
So that was Dr. Vishal Rao from HCG Hospitals, clearly addressing some of the most important questions. Yes, it's a good move. It's been appreciated from all sectors. The fact that phase 3 will include everyone who has the right to vote will be able to get the vaccines as well. But do we have the infrastructure for this? Are we ready for this? That is a completely different question, and only time will answer if India as a country is ready to go to the next step of vaccination in this fight against the pandemic. What do you guys think? Let us know in the comment section below, and also do not forget to like, share and subscribe to TV9 News. Thanks a lot for watching.